Hi everybody, we're happy to be back having another roundtable discussion. I'm Dr. Christopher Jeffries, this is Dr. Trevor O'Brien, and the new guy, Dr. Ryan Burke, filling in on a permanent basis for Dr. Steve Thomas, who's exited stage left.
Big shoes to fill.
And we are excited to have another cocktail and just talk plastic surgery and all things Northern Michigan in another favorite place, the Low Bar in Traverse City, downtown district. Trevor's been here before, was just talking craft cocktails.
Oh, yeah.
Tell me what you like about coming to this place.
Just the uniqueness of the environment is just, it's nice, dark, dim, kind of cozy, comfortable chairs. Gives you kind of feel like you're going back in time to a speakeasy.
Yeah.
A little bit.
Yeah.
And the drinks are amazing.
We're having old fashions.
Same. Yeah.
And what do you have?
It's a Boulevardier. It's a Negroni, but instead of gin, it's bourbon.
Okay, to each his own. Our bartender explains to us that this place has a ton of cool, unique whiskeys, bourbons. Definitely worth a stop down here. And we'll come at the end of the night. This is a one-off where we get to talk plastic surgery, so we're down here enjoying their hospitality. So thank you very much to Low Bar. Great spot in downtown Traverse City if you're out in the town. So I have to introduce our new guy. This is Dr. Ryan Burke, whom I've known for a long time, who was here as a medical student, went off as a resident to a great program at Emory in Atlanta. And I told you when you left that was my number one pick. I loved that place. I thought the program was fantastic. It's really the birthplace of flap surgery, moving tissue around, which is really fundamental to what plastic surgeons do from a reconstructive standpoint. He spent 6 years, he wanted to come back, and now he's in Northern Michigan with us. And we're super excited about it, couldn't be better. Tell us about Emory, tell us about what you learned, and what brought you back.
Well, I'll have to say, you definitely coached me up for the interview. I think it definitely helped. I love my time there. Atlanta, Georgia is a great place. And Emory, like you said, the history's there. They teach you everything from flap surgery to aesthetic surgery to reconstructive surgery and hand surgery. You get a great general depth of everything. And they're one of the few programs that still has a county hospital associated with it, which is Grady Memorial Hospital. And in that experience, you get a lot of hands-on experience compared to more of an academic training. And then you get a little bit of a flavor of academia with the Emory University Hospital.
So you felt pretty ready to go. You're ready to hit the ground running.
Of course, we have a lot of operative autonomy that everybody says that you would like in training. So we feel like we've gotten a good combination of cases, a general breadth of knowledge, and ready to go. Happy to be back here in Traverse City.
And we got you back because you knew about this place. Your folks are up here.
Yes.
It's absolutely fantastic transition because Dr. Thomas was done and we filled his ranks pretty quickly, and with a guy who's going to stick around in the long term. It's fantastic for our practice.
Yeah, it all worked out. The timing worked out. I mean, I would love to work with Dr. Thomas too. But working with, I met Dr. O'Brien in undergrad. We played ice hockey together, which was a lot of fun. We actually took ice hockey 2, which was an actual class at Michigan State University. Got to know each other there, and obviously he was a mentor for me all throughout medical school and turned me on to y'all. And I got to work with, of course, yourself, which was very helpful in training in medical school. Come on.
So what about the practice attracted you back? What are the pieces about what we do here that you thought was a good match for what in the skills in which you were trained?
Well, I think you have to go with the general knowledge. I mean, Traverse City, you're responsible for both reconstructive and aesthetic surgery, the general breadth. You can get called to do anything in the middle of the night. Any patient can walk through your door. You have to have a general knowledge, and that kind of matched with what I did at Emory University, and that kind of matched with wanting to be by family and be by home, and all those things kind of culminated in having a perfect opportunity here, an opportunity to serve the opportunity to serve the community, and the opportunity to be around Traverse City and how beautiful it is. Everything kind of works.
Sounds like it was destined to be.
Yeah.
But in the meantime, since you've been up, we've transitioned. We've done a lot of things through the practice in terms of aesthetic skincare particularly. Now people are coming for sort of the breadth of plastic surgery, but also the offshoot type of things, laser, injectable. That's been a real cornerstone of what we do now.
Yeah, and I would say when I was here as a medical student, it was largely a surgical and laser, and then, as I've been gone and as I've come back 6 years later, we've kind of transitioned from this Center for Plastic Surgery to Center for Plastic Surgery and Skincare, and now to launching this copper aesthetics line. I guess as the newbie in town, I'd love to hear a little bit more about it.
And I'd be happy to answer and get Trevor's perspective too. The concept though behind copper aesthetics is multifaceted, and it's a bit layered and it's metaphorical, but let me go into detail. The concept has been that this is a great metaphor for what we do. Think of copper, it's a beautiful metal. It's gorgeous when you put it up, but you know what? As it ages, it's gorgeous too. And that made a lot of sense because we're in the Copper Ridge development. And to me, that metaphor for something which is beautiful when it's young, beautiful when it's aged, and yet what can you do with the verdigris copper? You can buff it back to shape, and that's really kind of what we're looking at with some of our techniques. I think it's been a spectacular concept. And so what we've done is we're trying to take the top end aesthetic treatments, the top end of the spectrum in terms of the devices, the training, the expertise of the practitioners, and yourself included, to come on board and really deliver a practice which doesn't have a lot of boundaries. It's so interesting now when I look at things and I think about a problem that we used to solve purely surgically, but now we can layer in technological advances and then in an ongoing way, a maintenance regimen. It makes a ton of sense. The concept of how we did it before doesn't make much sense. This is the wave of the future, and we've augmented it with really good technologies. Trevor, you've been here now 2.5 years. You've seen them all at work. We've got different things in the works, so to speak. So tell me about what do you think works the best? What are your combo treatments? How have you leveraged these technologies to do better than the surgical outcome you probably were trained to do?
Yeah, definitely. I think some of the new stuff, the body tight, the bipolar radio frequency treatments, I think has been exceptional. Avoiding the downtime of surgery, the downtime, the scar, pain, recovery, of a big operation, big incision, getting similar skin tightening, fat reduction, without the same degree of, again, pain, cost, scar, recovery.
I gotta back up a little bit. Wait, I gotta back up. So we had a lot of iterations of different liposuction procedures. We've done this in office for years. We do it with varied levels of anesthesia too. But let's talk about, we have liposuction. You go for different forms of energy. We got into laser liposuction or smart lipo. This is the best in the world right now.
Oh, by far.
Talk about the body tight radio frequency. What's the deal?
So it's a device, and the difference is it's bipolar. So there's, like you said, there's been laser lipo, there's been radio frequency liposuction. The difference is this is bipolar, so it delivers energy between the skin level and a depth within the fat. You can set the depth that you want to treat.
So you have to have a little bit of fat.
A little bit of fat, exactly. Or I've used it on patients just for skin tightening effect alone, with minimal to no fat. Again, just for that skin tightening effect. But again, between those 2 points, you're delivering that radio frequency energy, treating all levels between the external skin and the deeper tissue that you're really trying to target. So it's pretty profound degree of energy delivery, which then leads to a pretty profound degree of skin tightening. So it's been great technology.
Have you used that yet in combo procedures? Like you've done that for skin tightening in combination with a little lift of something?
Yeah,
because I think that's been pretty cool.
Definitely. Again, it has its limitations as well. So the benefit, again, like you said, it's cool that we can layer procedures, but at the same time, our practice isn't limited. We can provide the non to minimally invasive all the way up to full invasive surgery. So sometimes we have the ability to say, we have this less powerful option called body tight or face tight if we're treating a smaller area. But at the same time, if that's not going to be powerful enough, we have the judgment and the ability to say, no, in this area, for instance, I've done it before where I've done a facelift for the lower face and the jowls, and then run face tight through the neck to address the neck. So it's combining those technologies where you need something more powerful for the face and for the jowls, but can also get some tightening.
I've got that coming up next week. And surprisingly, like already, Dr. Burke here has been popular with cosmetic surgery. And have you used some of that device, the radio frequency energy for the neck or for the tummy, stuff like that?
Of course, and I mean, I think, Dr. O'Brien hits it right on the nail on the head, was having something to offer patients in between, maximally invasive things like a facelift or an abdominoplasty and liposuction. And we've always had this gap in between, and that's always been because you have an excess of skin, we need to offer something to tighten the skin. And I think that is something that fits nicely in between those two algorithms, that offers a middle ground between the two, that maybe the patient or the person isn't a candidate or doesn't desire an operation that involves an incision, and maybe that liposuction isn't going to provide the result that they'd like. And having that middle ground is so important, and it's something that we didn't have access to, that I think is just revolutionary in how we treat patients.
It's been cool technology, but you actually made me think of something. Okay, so we were just talking about skin tightening. I think that's a really super important thing. We'll talk about surgical later. Okay, some of the skin tightening techniques. Oh, thanks so much. And but tell me about how the evolution of this thought about the process of aging and the correction of it has evolved, and what are you doing for mid-face and giving volume back? So
what I have to say is, we talk about body tight, we talk about skin tightening, but that's only one tool that we use. In the malar eminence and the cheek, is providing volume is important in what we do. So using fat grafting and using fillers and things like that help restore volume and support the lower lid, support lower lid position, are all important in providing a balanced appearance and a balanced look. And we talk about dividing the face into thirds and making the mid-face really set up and be symmetric to the upper and lower face.
So this is one of my things I want to talk about too. So mid-face, you're talking this area, essentially above the mask. That's a big deal. People come in and ask about that a lot. And the problem is, you say, okay, there's a surgery for that, but you need to put some volume, you need to put filler or something, but fat, you alluded to fat grafting, is basically a fancy filler. You can go liposuction fat and apply that as essentially a permanent filler, and we do that all the time. What's been your experience? Okay, we've got somebody who says, I'm wearing the mask and then I'm on Zoom and my eyelids look tired. Is it all about surgical, or tell me how you blend it?
Definitely a layered approach. As the face ages, we know you have descent of soft tissue, atrophy as well. So again, a lot of times we need to add that volume in to restore that full cheek, that prominence, the youthful look. So it's definitely a combination. Again, if you're just pulling things tight and tightening up the lower lid without adding that volume, you're not restoring that youthful appearance. You're not restoring that, look of beauty.
Talk about that tough area too. So people say, well, I'm okay with the lower eyelids, but that groove, like there's that depression that goes from the eyelid to the cheek, that junction. What's that all about?
So that's something called the tear trough ligament, and it's actually a structure that attaches from the bone out to the skin that anchors that skin in and pulls that in and gives you that almost a double bubble where you have the lower lid then transitioning to the cheek.
In some ways, it's not the eyelid's fault.
No.
I like to tell it to patients, like, you think your eyelids are bad, they have bags. No, in a lot of cases, it's that the cheek is descended, you've lost volume here, and then that ligament, the muscle attachment to the orbital rim, is still intact. So you got to talk about what the anatomy is there that could be improved.
Yeah, and actually, a lot of people now, I don't know if you're including this, but you want to maintain that volume so you don't take out that fat. So when we're talking about that lower lid, how it bulges out, and people think, I have this bulge here, you need to just get rid of it. It's not that we want to get rid of it, we just want to redistribute it. We want to place it, we want to divide that ligament, release that, so it's a nice smooth junction from eyelid to cheek, and drape that fat across there to fill that in. Because again, we want to maintain volume, not get rid of it.
And maybe there are different ways to do that by sort of era or by age, If you're in your 30s versus your 40s, you might treat that differently when you start to see it. It's genetic. People talk about, oh, my dad has that thing. Well, I got to fill it in. I want to do lower lid surgery. Maybe not. Maybe the idea is to do something short of that. Have you seen that? I don't know in training, but up here, I know you've seen it already. 30, 40, 50, 60 years old. Those are different treatment algorithms for a similar problem, but anatomically it changes, right?
Exactly. And when you talk about lower lid, and Trevor hit it right on it, and, the nail with the hammer, is everybody talks about, originally it was resect, get rid of that fat. it's causing a bulging, it's causing a facial contour irregularity. And the goal now is, and is focused over the last 20 years, is redistribution of fat and really masking, using the fat that you already have and really masking that transition. And as people age, that, like you said, that thing changes.
Use what you have because fat's your friend, right?
Yeah,
So somebody who's in their 30s, they start to see a little groove. Well, why would you come to a plastic surgeon if you don't think you need surgery? But the truth is, we might say, no surgery for you. We're going to apply a little bit of filler, okay, a little bit of something that comes out of a box, and then transition. Maybe we do a little laser tightening of the lower eyelid, and when you're ready for a surgical approach to tighten it, it's reasonable. We'll have the continuity.
Definitely.
I think that's the way. That's probably the way to look at it for lower eyelids. I think that's such an important concept. People have asked about that so much at this point. I want to talk facelift too. Here's an interesting thing. So to just transition a little bit, the classic facelift, the plastic surgical procedure of choice, is to tighten up neck, tighten up jowling. We've seen so many changes though in how that's done at our meetings and things, and he's been there. So they say, well, no, we're not going to do direct neck work. We're going to just mini lift. How do you use it? What's the appropriate time when you do mini lift, full facelift, touch-up lift as people go down the road? Because I think personally, my perspective is that operation's not dead. It's a huge improvement in contour that you must have in addition to the other things that people promote, volumizing the face. You got to get some of that sag up.
Right. When you talk about layering procedures, that's one thing. When you try to have a filler or fat or some material that you're putting in the face, try to correct a significant degree of laxity and a soft tissue descent, it's not powerful enough. You get a simian look, a full look, chipmunk cheeks. Definitely, I'm not saying that volumization fillers, fat grafting aren't beneficial and useful in the right situation, but they're not the end all be all. I think
But if that's your only, tool, then you're going to put some more of that stuff. You know?
End up overfilled, yeah. So I think facelifts aren't going away. They're still a very key, important operation. And I think it's primarily dictated by the patient's anatomy. I'm pretty aggressive as far as opening the neck and addressing, generally it comes down to a degree of platysmal banding or the
what are those
central
stripes?
kind of lines.
Okay, what are the? This is a quiz. What are those stripes in the middle of the neck? What's that all about? Why does that look aged?
So basically what it is it's a platysmal band. And a platysma is basically a long, thin muscle that goes from your jawline down to your neck and it attaches on your clavicle. And basically what's going to happen is as we age, it kind of sags forward and becomes less innervated. And those platysmal banding are something that patients are really bothered by. And at rest, especially at rest, it's one thing when we're animated and we do this and we see it. It's another when at rest it's there all the time. And if it's there all the time, no matter how much Botox, no matter how much filler, no matter what you do to that area, it's going to be visible. And the only way to do that is to separate it from the skin and to plicate it and to move it around and do with it what you need to do to make it go away and then redrape the skin without tension. And that's going to allow that platysmal band to be masked.
So there's an anatomical feature of the neck that people see that they think, oh, I got this hanging skin. But the problem is you really can't address it but for surgical techniques, which are time honored, and plastic surgeons can own that because that's really still an important thing to do when people reach that point.
Yeah, I mean, that's, we talk about facial descent, we talk about decreased volume, we talk about all these things and fillers and they all have, and fat grafting, they all have their position in facial rejuvenation. But at the end of the day, things like jowls and the corner of the mouth descent and platysmal banding and all these things, those treatments don't necessarily address those. And that is the tool that we have in the arrow in our quiver that we're able to kind of use that most people can't. And that allows us to use a facelift when we need to. And that's what's important, and that's something that we can offer patients.
Yeah. But also to have the temerity to say, no, you're not ready for that yet. I've got another trick that's going to be better in the short term, and then someday we want to coach people through that process. I think it's a really important point.
Yeah.
Not too much too soon.
Right. Yeah, I lay it out. You're balancing the degree of improvement you want to see with the pain, cost, scar, and recovery of the procedure. So as you're going to get more significant improvement.
I got to try to remember pain, cost, scar,
recovery. Yeah. So
like it.
yeah, we can help them. making sure their goals are realistic and what they want to achieve is realistic. And if they say, no, I don't want the recovery of a big surgical excisional procedure, talk to me about that face tight,
Right.
or
But even
little
that is
filler,
mostly
little
in
Botox.
office now. We're doing
Yeah.
that on our site, so it's a comfortable procedure where, and I think maybe we touched on this on previous roundtable, but it's really interesting the familiarity that people have with our staff. They come in, they see the same staff, they know that they care about them, they saw them before, and from a check-in to check-out procedure, doing things in the office is a pretty neat deal.
Privacy, boutique setting.
That's the same as they're doing in the bigger cities. I think we've caught up with that pretty significantly.
Yeah.
Total win for the patients.
Definitely.
Talk about another concept I think is going to be really cool. We're going to expand a bit into Petoskey. He knows about it. I'm happy to introduce it, but you know the story on this, that we're going to do a storefront.
Yeah, I mean, I'm very excited. I think that Petoskey offers a natural kind of extension of what we do in Traverse City. And I think that, Chris, Trevor, they've been up there, they've done cases, they've helped out the surgeons, they've helped our community in that area. And it's a kind of a natural transition for us to provide a full service anchoring point for us up in Petoskey that's going to allow us to, create a base and create a place for patients to get the products they need.
And more potential expansion. I mean, at the end of the day, the thing is, this region is fascinating. And I came from downstate, and you said, oh, there were plastic surgeons in northern Michigan. I wouldn't have believed you. But the truth is, it's absolutely very popular. And you look at the UP, we have patients, we have fantastic people who come down from Marquette, Sault Ste. Marie. So we're going to have outposts where they can come see us quicker and easier. We'll make the effort to come up and see them. And we're going to do a brand new, hopefully opening in early spring. We're talking about Copper Aesthetics, downtown Petoskey on Lake Street. This is going to be storefront retail where we're going to really look at skincare products. A lot of these cosmeceuticals, the things that people can use in their homes day to day with some guidance are really powerful now. The things that you can use like that are not surgical, but they really set you up for the future. When we see patients back who've used good products for decades, their skin looks fantastic.
Yeah.
So we can coach them through that. We can get them into the right products. We can do minor procedures, injectables, lasers that clean up the skin appearance, particularly sun damage, things like that. And then do private consultations in a fun setting. Up-tempo, people excited to be there talking skincare. This is going to be a revolution for us because this is non-medical. This is skincare, but with some fun. Okay, and we're going to do that in Petoskey first, and then roll it out. And let's see where we need to go in northern Michigan, because this is a really great area. People are excited about this topic. We thank you for tuning in, because frankly, I think that's why people are listening.
Right.
They're interested to see what we can offer, what we can do. So that's our new thing.
Yeah, and it'd be good to hear from the people where they want us to come next. If there's thoughts, if there's demand somewhere, we want to come to them, meet them where they are, and bring it to them.
It's a cool concept.
Yeah.
What other things have you seen? Okay, since you've been here, people ask about something aesthetic that you've had to figure out. Like, okay, yeah, that's a treatment regimen that we have on hand. What do you have in your toolbox that you've seen up here?
There's a lot, and I honestly think Trevor has really spearheaded this, and we've changed. We've gone from surgical only facelifts, realizing that is not all we can do for these patients. These patients need constant skincare and things that promote collagen formation, things that promote increased skin health, and I think that those things are very important. And like I said, Trevor's kind of spearheaded this. Retin-A treatments. He's spearheaded hydroquinone treatments, and adding all these things to a complex facial treatment plan that has led to kind of cornering all aspects of treatment.
So skin tightening with a bit of resurfacing that you do at home through a product, which we can sell storefront now, okay? And then bleaching cream for dark spots until you graduate to doing a laser treatment, okay? And then the next thing is going to be minimally invasive skin tightening. We're getting that through microneedling and laser resurfacing, which is, I try to explain to people, it's a little bit, you know, the downtime is worth it. You're going to have some roughed up skin appearance for a bit, but then you get tightening as a result.
That's that long lasting. It's not a temporary, it's not something that wears off.
Yeah.
You know, combining it with a good skincare regimen. I think, you know, you hit on that, Ryan's hit on that. That's so key, you know, maintaining those results. Because yes, we can do a facelift, but if we can do things to really maintain those results, like an excellent skincare regimen is the cornerstone of that.
My favorite consultation, honestly, when people come and they say, I'm here to talk about, hey, what can I do? I really do enjoy walking out of the room and saying, you have spectacular skin, things are in really good shape, you're not ready yet for a surgical procedure. I know you thought you did, and that's why you trust us, and I really appreciate it. But if I can start you with some products to do some tightening, and then maybe a light laser to get a little bit of the sun damage out, we buff that up a couple times a year, and then transition to something in the future, that's my favorite.
Right.
I love telling people that they have beautiful skin, they have beautiful structure, and I can't offer you a surgery yet.
Yes.
It's one of my favorite things.
Yes.
All right. Well, this has been a fantastic talk, and I love having a different venue at all times. This has been super fun, and we hope that the audience has enjoyed it too. We're going to keep going with this. We're going to keep finding areas in northern Michigan that would be willing to host us and have a different cocktail and just a roundtable about plastic surgery, new friends and associates in the practice, and the progress of the practice in general. So cheers, gentlemen.
Cheers.
I appreciate you joining me. Thank you very much.